Hi everyone, welcome to my channel, F&P Brain Boosters. I hope everyone is staying healthy and staying well, especially during these trying times. So the purpose of my video today is to shed some light and give you some perspective on what it is like for a healthcare worker to work during this COVID-19 pandemic. So I am a registered nurse and I work in an inpatient acute care setting, which is a hospital. So we are admitting patients, and patients are typically sick when they're on our unit. Obviously, if they weren't, they wouldn't be in the hospital to begin with, right? So something I do want to point out, I'm not working with COVID positive patients at the time. However, the hospital that I am working at currently has positive cases. But those patients typically require more monitoring because they're more sick or have other issues, other comorbidities or diseases going on that puts them at higher risk for mortality or death. So these patients typically tend to be in a unit that requires more extensive monitoring, such as an ICU, aka an intensive care unit. So although they're not on my unit and we're not in direct contact with these patients, they're still in my facility. So as many of you may know, COVID-19 is a virus that is airborne and droplet. So patients or people spread it by coughing, right? So when you cough, you produce droplets. You know, they're so tiny, they're so small, you can't see them. But if you were to put a magnifying glass or, something that really can zoom in on the situation at hand, you can see as they're coughing or sneezing, these particles of mucus, right? I don't mean to sound nasty, but you can see all these droplets coming out. And that is essentially what is contagious. That is essentially what can put others at risk for contracting this virus, right? And another thing, the World Health Organization, or the WHO, has stated that it can take, or that this virus can remain on objects, surfaces, or inanimate objects for up to 3 days. It can be as much as a few hours or even a few days. However, it's not fully established or known how long, but just to simply know that it can remain on objects for up to a few days is quite nerve-wracking, right? I mean, just to know that you're in a place such as a hospital, which is a petri dish for germs, right? Germs are rampant where I work. So I just kind of wanted to share my perspective on what that's like, showing up to work, being on the front end, not necessarily, like I said, working with positive or COVID positive patients, but just being in an environment, knowing that there are positive cases within your facility and knowing that you're coming into an area, a workplace that exposes you to contracting the virus yourself. I just wanted to kind of shed some light and to give some insight on that in case some of you may be wondering what it's like coming from my perspective, a healthcare worker's perspective. So I try to stay grounded in what I know, obviously, and knowing the things as far as how it can be spread, right? So we know that it's airborne, it's droplet, right? It can be spread through direct contact with that patient or that person who has it, and also by touching an inanimate surface and then touching your nose, your mouth, and just anywhere on your face where it puts you at risk to being in contact with those germs, which is why they say don't touch your face. The CDC recommends not to touch your face at all whatsoever. And then to always make sure you're washing your hands, you're practicing good hand hygiene, washing your hands for at least 20 seconds. And, or if you don't have immediate access to soap and water, to at least use an alcohol-based hand sanitizer, and to rub it in good until the liquid essentially evaporates, right? You're not wanting to pick up a paper towel and wipe the excess off because now you've just made it ineffective. You want to make sure that it evaporates on its own. So that is the key, is using good hand hygiene in preventing the spread of this virus. So just how is it for me firsthand, being in this environment and knowing what's going on and just having to take care of people, not knowing if they have these symptoms or not, because also the CDC says that it can take up to 2 weeks for a patient to start to show symptoms, for a person to show these symptoms, and meaning they can be asymptomatic or not showing any symptoms for as long as 2 weeks. That's scary, right? You can just be talking to them and everything could be fine, but they're over here spreading germs, right? Spreading the virus, and you don't even know it. They don't even know it. Which is why it's so important to practice good hand hygiene and do all those things and that the CDC recommends. And so for me, going to work at times can be a little nerve-wracking for me, even though we don't have COVID-19 patients right now, but just knowing that they could. it's unknown at that point. Say, for instance, they start to show respiratory symptoms and you've been working with that patient, for the past few days. And now all of a sudden they're complaining of a sore throat and they start to have a fever, right? It's not uncommon to feel like, oh my gosh, like, do they have it? Like, and I was around this person, now am I at risk? Do I have it? So it is somewhat nerve-wracking, when you're working in contact with these patients. And I deal with some pretty high acuity patients. So high acuity referring to like the level of care that they require, how sick are they, resulting in the amount of care that they're going to need. If they're really sick, they're a higher acuity, which means they require more time, more attention, more medications, more whatever in their management to really help treat them and manage whatever it is that they've got going on. And so we deal with a lot of patients that are high acuity and furthermore are at higher risk for contracting this virus, if so ever they may come in contact with someone unknowingly, and possibly succumbing to this virus because they have other comorbidities. The more comorbidities you have, essentially the more at risk you are for mortality or death. If you've got things like heart disease, asthma, diabetes, if you're overweight, these put you at an even increased risk of mortalities and further complications to the disease. My husband, one of his really good friends that he's known since high school, just recently passed from COVID-19. So it's very real. And it really hits home, especially when someone that you've known personally has succumbed to the disease. So for me, like I said, it is fearful. I do find myself at times a little fearful and uncertain about just being at work, having to do what I do. But at the same time, I'm reminded and comforted by the fact that these patients rely on me. They depend on me. This is part of my job duty. This is what I knew that I would sign up for. Of course, we never expect ourselves to be in the middle of a pandemic, right? Having to take care of these patients. We don't expect that, but we know that patients are sick. They're going to require our attention. That's the reason why we're doing what we're doing. And I know that from early on, I was passionate about taking care of the sick and helping those who really needed it, especially in their most vulnerable times, such as now, when they're not sick, when they're not able to do for themselves, whatever the issues are going on. They may not have that extra support or help at home to help get them through what they're going through, which is why they need to be hospitalized in the first place. So just remembering why I'm here and what I could potentially be to that person. They rely on us to help them, to get them well, to get them through this dark and vulnerable time in their lives. The last thing they need is for someone to walk out on them when they need them the most. It's like doctors when they take the Hippocratic Oath, they vow to do all they can for that patient, to do no harm and all of those things. They vow to be there, and also like what it is like when we make our wedding vows, right, to our spouse, through sickness and health, for better or for worse. You make that promise to be there no matter what the case may be. Right. So the same goes for nursing. This is what we are here for. This is a part of our job description and what we have the passion for, and this is my passion to help the sick. But at the same time, we're human too, right? We can't help but fear the unknown, right? And especially especially knowing that we're putting ourselves in such risk, and not just essentially ourselves, but potentially our families as well. That's becomes more surreal when what those risks are and how close you are to feeling the effects of those risks. It can be a little nerve-wracking. The hospital where I work at, we don't have that much PPE or personal protective equipment to keep us safe. We're running out even of things such as even like surgical masks to protect ourselves. I had to use the same masks now for over 2 weeks. The same surgical mask for over 2 weeks. And luckily I have another mask, my coworker. She was able to make a mask out of just fabric, so I wear my surgical mask and then that fabric mask over it because it's more protection, double the protection. But I have to be wearing that same surgical mask for over 2 weeks now because we don't have any. And the last time I was at work, I asked for an extra and they said they were out. They didn't have any. So that makes the situation more nerve-wracking when you're in a place where they don't have the right equipment. And it's not their fault. I mean, they can't get their hands on it. You know, they're in a shortage everywhere you go. You know, you hear of all of these hospitals being in a shortage. But now it furthermore brings into perspective that not only are we working in these high risk areas, but we don't have the proper equipment to even protect us in the event that we should be exposed to this virus. It can sometimes get to you, but you have to stay grounded in your faith and in knowing that, you know, God will protect you. And you just have to pray about it, because some things we don't have control over. And, you know, we just have to do as much as we can in the things that we do have control over, such as practicing good hand hygiene, social distancing, staying at home if we don't need to come out, doing those things that we know can protect us. But the things that we don't have control over, you know, just make sure to remember who's in control, and to practice health, you know, having a healthy mindset. You know, I talked in my other video about meditation and how imperative and crucial that is for your own mental health and well-being. You know, you don't want to be carrying the whole weight of the world on your shoulders, especially when you're taking care of patients who, you know, are going through their own issues, you know, their own ailments. They don't want to see a nurse coming in looking, oh gosh, like the whole weight of the world is on their shoulders. You know, they've already got enough to worry about. You know, that's one less thing to worry about is your nasty attitude because of how you feel, and you're focusing on that instead of what they feel. You know, you have to empathize with these patients and remember what it is that they're going through, and to just look at the brighter side and just to remember why you're there, you know. And that's really what keeps me going, essentially, is just to remember, you know, why these patients need me, why I'm here, why I chose this profession in the first place, and how I feel that I'm called, you know, how I feel God is calling me, you know, to use my talents to help, you know, in the care and taking care of someone else. But yeah, I just wanted to share my perspective with you guys on what it's been like working, you know, in a hospital setting, and a healthcare setting, being a healthcare worker, especially during this COVID-19 crisis or pandemic. You know, it is scary, it is fearful, and I'm human. I'm not afraid to say that. I'm not afraid to say that. You know, I know everyone looks at us and expects us, being nurses, you know, to be, they look at us as superheroes, and they expect us to be courageous and just able to withstand all, you know, and just to get through whatever is thrown our way. But the truth of the matter is, we're human too, you know, and just like everybody else, we fear, we hurt, you know, we're scared. We know the realities of this virus and how it can potentially, you know, we could be potentially at risk for contracting it ourselves, and we worry about bringing it home to our loved ones, our own families. You know, so we just have to keep in mind that, you know, healthcare workers are human too, and we go through and we fear the same way that everyone else in the world does. Okay, so hopefully this has shed light and brought a little more perspective on what it's like from my perspective, from my point of view, and just to say that hang in there, just continue to stay grounded in positivity, and to, you know, practice good mental health and isolation if you need it. You know, it's okay to meditate and isolate when you need to, but also to be surrounded with love, and to practice, you know, reaching out to others, and to remembering to tell everyone that you love them, you know, remembering to make the best of every moment that you have, because I don't want to make this all grim and depressing, but, you know, everyone has their time. So just trying to focus on the time that you have here while you're here and make the best of it. And to remember to tell those that you love them, you know, to give that hug to that person, you know, when you see them, not knowing, especially if you don't know when you're going to see them again, you know, just remember to practice positivity and tell others, you know, good things, to share in the good things and not to be negative, you know, but to focus on the positive aspect in every human being. You know, I think that can help make someone's day even better, especially in a position to where somebody's vulnerable, you know, to help make their days better. So I hope this message was good and empowering. I hope you guys are staying healthy and well. And please remember to always wash your hands, social distance yourself. Don't go outside if you don't need to. And remember, we will get through this.